Tens of thousands of Rhode Islanders who rely on health insurance each year could see their rates go up. Target 12 consumer investigator Sarah Grinelli has more on what you can expect. Sarah?
Mike, each year health insurers propose a new premium rate to state regulators, and this year some could go up by more than 10%. Rhode Island health insurers are looking to boost premium rates across the board. The proposals were recently submitted to the Office of the Health Insurance Commissioner, which is a requirement each year.
The process starts back in March, where we issue filing instructions to the insurers, and then they file those rates in May, and we release them publicly in June.
The state is now in the review process, scrutinizing the increase since about 173,000 people in Rhode Island rely on these insurers. For the people who don't receive health insurance through their employers, also known as individual market, Blue Cross Blue Shield and Neighborhood Health Plan of Rhode Island requested an average rate hike of 8%. Small market insurers, which provide coverage for businesses with 2 to 50 employees, are seeking an average increase of 11.5%. Large market insurers proposed an average increase of 7.9%. Those insurers cover businesses with more than 51 employees. But what's the reasoning behind the potential rise in premium rates? Patrick Tighe, the health insurance commissioner, says the reasoning is twofold.
The first is that the insurers expect significant increases in provider prices, meaning the prices that are charged by healthcare providers for their services. They're expecting significant increases there.
He says another contributing factor is health insurance companies are expecting to see a significant increase in prescription drug prices. Now the Office of the Health Insurance Commissioner will decide whether to approve, modify, or reject the proposed rate increases.
Is that reasonable? Is that in the public interest to approve these costs? Meaning, does it contribute to consumer and business affordability? But also, are insurers charging enough to ensure that they can cover their costs?
And the health commissioner says he's looking for the public to weigh in and for people to submit comments over the next month. A final decision will be made in mid-August, and the new rates could go into effect in January. Sarah Grinelli, 12 News.
Sarah, thank you. And if you want to see how much your insurance might go up, we have a full breakdown of the individual insurers right now on WPRI.com.